Please subscribe our channel. Press bell icon. Streptococcus. It is a gram-positive bacteria, non-motile, non-sporing, facultative anaerobic. Types: alpha, beta, and gamma. In alpha, partial hemolysis. In beta, complete hemolysis. It is a most pathogenic organism. Gamma is a non-hemolytic. Pathogenicity. Respiratory infections produced by Streptococcus. Tonsillitis, pharyngitis, otitis media, quinsy, and Ludwig angina. In skin and soft tissues, produce erysipelas, impetigo, cellulitis, pyoderma. Non-separative diseases are acute rheumatic fever, acute glomerulonephritis. Acute rheumatic fever due to group A beta streptococci. Age 5 to 15 years. Pathology 2 stages: exudative stage and proliferative stage. In exudative stage, it is an acute phase. Fibrinode necrosis of connective tissue take place in this stage. Second stage, proliferative stage. It is a prolonged process. Ash of nodules seen in this stage. Clinical features. Ash of nodules occurs 3 to 4 weeks after infection. Seen in interstitial tissues of myocardium. Macellum patch seen in posterior wall of left atrium due to the scarring of mural endocardium. Bread and butter appearance due to fibrinous inflammation of pericardium. Then pancarditis, acute synovitis, Jacob's arthritis. Low pitch mid diastolic murmur, Caddy-Coombs murmur. Sydenham's chorea, erythema marginatum, and subcutaneous nodules are the clinical features of rheumatic fever. Diagnosis. Serodiagnosis: anti-streptolysin O titer, that is ASO titer. ASK, anti-streptokinase S. Then anti-streptosine test, throat swab, increased ESM, and increased CRP. Jones criteria. Major criteria are pancarditis, polyarthritis, subcutaneous nodules, Sydenham's chorea, erythema marginatum, ASO titer. Minor criteria: fever, arthralgia, increased PR interval, increased ESR and increased CRP, leukocytosis, previous episodes of rheumatic fever. Important points. Least affected valve in rheumatic fever is pulmonary valve. Most affected valve in rheumatic fever is mitral valve. Causative organism is Corynebacterium diphtheriae. It is a gram-positive organism, also known as Loeffler's bacillus, non-motile rods, having Chinese letter of cuneiform arrangement. Media, Loeffler serum slope and tellurate blood agar. Three types: gravis, intermediate, and mitis. Gravis is the most fatal type. Diphtheria. This disease, also known as gullet disease. Age group, mainly 1 to 5 years of children. Mode of spread, droplet infection. Incubation period, 2 to 6 days. Pathology. Inflammatory exudates form a grayish membrane on the tonsils and the respiratory tract, which may cause respiratory obstruction. That release an exotoxin encoded by beta prophage. That exotoxin inhibit cellular protein synthesis, resulting in tissue necrosis. Clinical types. Three major clinical types. They are anterior nasal, pharyngeal, and laryngeal. Clinical features: fever, tachycardia, sore throat, lymphadenopathy, elevated grayish green membrane on tonsils. Laryngeal diphtheria, having husky voice, high pitched cough, and respiratory obstruction. Pharyngeal diphtheria, most common type. Incubation period 3 to 4 days. Bull neck due to cervical lymphadenopathy. Malignant diphtheria, edema of sublingual area. Cutaneous diphtheria, having punched out ulcer and non-healing ulcer. Complications: asphyxia, death due to acute circulatory failure, post-diphtheric paralysis, myocarditis. Diagnosis: Schick test. It is the susceptibility test for diphtheria. Loeffler's medium for early diagnosis. Causative organism is Bacillus anthracis. It is a rod-shaped bacteria, non-motile, gram-positive. It is the first pathogenic bacteria observed under microscope. First Bacillus to be isolated in pure culture. Anthrax. It is a zoonotic disease. Spread of infection through inhalation of spores of bacteria, infected animals, contaminated wool, hair, etc. Pathology. It mainly affects skin, GIT, oropharyngeal, lungs. First, the inversion of the organism. Then it multiplies in the body and releases exotoxin that causes edema, necrosis, and hemorrhage. Clinical features. First one is cutaneous anthrax. Direct contact with bacilli. After incubation period of 1 to 2 days, a small papule appears in the body. Then it will become vesiculate that contains serosanguinous fluid. Papules are surrounded by erythema and induration. It is a painless lesion. First, a small papule appears in the body. Then it will become vesicles that contain serosanguinous fluid. Vesicles become pustules. Pustules become ulcerated with a depressed black eschar. So it is also known as Hyde-Potter's disease. Pulmonary anthrax mainly spread through droplet infection. It is also known as inhalation anthrax, wool sorter's disease. It is an occupational disease spread through droplet infection. Incubation period is 5 to 6 days. Main symptoms are fever, malaise, non-productive cough, dyspnea, hematitis, etc. Then gastrointestinal anthrax mainly occur through contaminated meat. Organism deposits in duodenum, terminal ileum and cecum. Main symptoms are fever, abdominal pain, vomiting, bloody diarrhea, mesenteric lymphadenitis and dysphagia. Diagnosis: blood culture. Polymorph leukocytosis is seen in blood culture. Then gram staining, agar gel precipitation inhibition test. German measles, also known as rubella 3 days measles, caused by Toga virus. Incubation period 2 to 3 weeks. Classical triad of rubella: cataract, cardiac abnormalities, and deafness. In eyes, cataract, glaucoma, microphthalmia. Ear, sensory neural deafness. Heart, PDA and pulmonary artery stenosis. Skin, blueberry muffin lesions. Diagnosis: increased titer of IgG antibodies. Most common test is HAI, heme agglutination inhibition test. Leukocyte count is normal in rubella. Prevention: MMR vaccine. Measles or rubeola. Family: Paramyxoviridae. Genus: Morbilliform virus. Measles is a highly contagious infectious disease caused by measles virus. Transmission: airborne infection through cough and sneezing. Portal of entry: respiratory mucous membrane and conjunctiva. Incubation period 10 to 12 days. Clinical features: fever, sneezing, running nose, cough, redness of eyes. The characteristic erythematous non-pruritic maculopapular rashes of measles begins at the hairline and behind the ears, spread down the trunk and limbs to include the palms and soles. Pathology: virus enter into respiratory tract, multiplies locally, then it enter regional lymph nodes, further replication, then that will produce primary viremia, then multiplies in reticuloendothelial cell and produce secondary viremia and causes dissemination throughout the body. Warthin-Finkeldy cells are found in respiratory and lymphoid tissues. Diagnosis: leukopenia in early stages, leukocytosis in later stage, CSF rise proteins, ELISA for IgG and IgM antibodies. Complications: respiratory system, croup, bronchitis and pneumonia. Eyes, corneal ulceration, keratitis, blindness. In ear, otitis media. Heart, myocarditis, GIT, diarrhea. CNS, SSPE, subacute sclerosing panencephalitis, that is a least complication of measles. Yellow fever, that is caused by group B arbovirus, genus Flavivirus. It is a zoonotic disease transmitted by Aedes mosquito. Incubation period 3 to 6 days. Yellow fever is an acute hemorrhagic fever due to infection from viruses of the family Flaviviridae, single-stranded RNA virus. Pathology. In liver, acute midzonal necrosis occur that will lead to deposit of Councilman bodies and Torres bodies. Clinical features 3 stages. First stage or period of infection. It lasts for 3 days. Symptoms fever, headache, myalgia, nausea, vomiting, relative bradycardia. Second stage or period of remission. Third stage or period of intoxication. Symptoms high fever, body pain, hemorrhage, organ dysfunction, jaundice, finally death. Diagnosis detection of IgM antibody by ELISA test. Prevention live attenuated vaccine 17D strain. Please subscribe our channel. Press bell icon to get continuous